Hello everyone. Today I want to talk about different types of breathing. We know breathing is important. It is something that we are doing all the time. Breathing gives us the power to do something. Through breath, a lot of healing can happen in the body. But when we breathe in a proper manner, in different manners, we can harness the oxygen so well that it can be made available to our tissues in the most optimal manner. The first type of breathing that I want to talk about is lateral ribcage breathing. A little modification with the lateral ribcage breathing. So we have our lungs here, which are our main organs that take in oxygen. So they are surrounded by ribs all around. So what we'll do is we'll put our hands on the side of the ribs, the lower ribs here. We'll put the hands here. So this is the waist, a little above that, where we can feel the bone here. We put our hands here, we take a deep breath in, and from the sides, we push our ribs into the hands. So we push the ribs into the hands with the in-breath. And with the out-breath, we breathe out from the mouth and squeeze the hands in. Again, as we breathe in, we push the lateral ribs in our hands. Breathing out, we push them in. Now we'll add a little twist component to it. So we'll breathe in, push the ribs out in the hands. Breathe out, squeeze the hands and the ribs in and twist to any one side. Again, we'll breathe in, push the ribs out, breathe out, squeeze in. Twist more. One last time, breathe in, push the ribs out. Breathe out, squeeze in, push the ribs in, twist a little more. And come back to the center. We will repeat it on the opposite side. A breath in, pushing the ribs out in my hands. Breathing out, squeezing the ribs in. Twisting to the opposite side. Again, a breath in, pushing the ribs out in the hand, breathing out, squeezing them in, and twisting to the side. One last time, a breath in, pushing the ribs out, breathing out, squeezing them in, twisting a little more, coming back to the center. This can be done sitting or standing. Next is pursed lips breathing. So we take a normal breath in through the nose. We breathe out as we want to blow a candle. Again, a breath in through the nose, out through the mouth like blowing a candle. The incoming breath is the breath of our sympathetic nervous system. It energizes us. The outgoing breath is the breath of the parasympathetic nervous system, which rests us, relaxes us. So when we do any such breathing where I am blowing air out and taking long exhalations, it is very, very, very good for relaxing us. So it's helped to beat that anxiety, to relieve pain, to ease out tired muscles. All of that can be helped with pursed lip breathing. Can be done sitting or standing 5 to 7 times and you are sorted. For how long? As long as your breath allows. Next, we will do decompression breathing. This was founded by Dr. Eric Goodman, one of the very, very celebrated chiropractors. So this is really good for the back because we've been sitting with a hunchback. It helps the posture, it helps the muscles, it helps the whole body and the lungs in general. In decompression breathing, our thumb goes on the lower part of the ribs. The pinky finger goes on the hip bones, the pointy little bone that we find here. Our shoulders go back and straight, chin is back. This can only be done standing. So chin back, shoulders back, and the fingers here. So what will happen in this is when we breathe in, we will feel the space increase a little in between our fingers. When we breathe out, we have to maintain this gap. We cannot let this gap come down. This is why it's called decompression breathing, because I'm not letting the space here get compressed. So all care we have to take is chin back, shoulders back, and the gap between the fingers, between my pinky and thumb, should not reduce as I breathe out. Okay? So it's technical to listen but easy to do. So hands here, thumb on the ribs, pinky finger on the hip bone, shoulders back, chin back. You'll feel the ribs behind, on the sides, everywhere, really engaging as we are breathing out, because we don't allow the gap between the fingers to decrease. It can be a little challenging for you to do, but it's really good for the whole of the posterior chain of muscles. So thumb here, lower ribs, pinky on the hip, a breath in and breathe out. Again, a breath in. This gap increases even more. One last time, a breath in. And we can relax. While we are doing all this breathing, it's good to pamper the lung meridians as well. So, very simple. Just tap the area on the upper chest, under the collarbone, 3 to 4 times with the hand, and then just rub the whole front of the arm, forearm, and then take it out as you rub the thumb. Other side, we have 2 lungs, we have to do both sides. Tap it, front of the arm, forearm, and take it out from the thumb. Then another great way of breathing is by throwing the air out, making some sounds like a ha sound or a hu sound. So we take a breath in again, and then we do some ha 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 ha. Again, a breath in. It's more like a cough, but it's a very good way of getting some percussion going in here. A breath in. 3 to 4 times, this can also be done. Another way of breathing is box breathing, where we breathe with counts. So we breathe in, hold the breath, breathe out and hold the breath for equal counts. We can do it for 3 counts, 4 counts, 5 counts. Say we breathe in for 3 counts. Hold for 3 counts. Breathe out for 3 counts. Hold for 3 counts. Again, breathe in for 3 counts. It can be anything. Box breathing means to breathe in the same counts with the same window. Another great thing is this little instrument. It's called a spirometer. Anyone who has phlegm or you're prone to any lung disease, asthma or any of that, a superb thing for them. And in general, any post-infection lung recovery or getting a good lung, good breathing capacity in general, this little machine is brilliant. All we have to do is breathe in the tube and get these balls to go up. The more pressure we exert to breathe in, that much of balls we can get them up, and we can hold them up for as long as we can, and then we generally breathe out. And last but not the least, one of my most favorite way of breathing is the Bhastrika Pranayam, which is a really simple way of breathing. We teach it on our meditation and breath workshops of the Art of Living Foundation. We take loose fists in front of the shoulders, and as we breathe in, hands go up, fists open. As we breathe out, hands come down, fists close, and we breathe out with a little force. So it goes like normal, forceful nasal breathing. We can take about 15 to 20 breaths in this, best done sitting in Vajrasana or sitting down. And the most powerful breathing technique that I have ever learned is the Sudarshan Kriya Yoga. So really, to get great lungs and great lung capacity, best to join a meditation and breath workshop with the Art of Living Foundation and learn the Sudarshan Kriya Yoga. And the Sudarshan Kriya is a really powerful breathing technique to help the lungs breathe really well. So wish you good lungs, good oxygen, and a great healthy life. Bye.